What are the safest painkillers for diabetic patients? When it comes to selecting painkillers or anti-inflammatory drugs for diabetic patients, there are several factors that need to be considered. Blood glucose control. It is important to choose medications that do not significantly affect blood sugar levels. Certain painkillers and anti-inflammatory drugs can interfere with glucose regulation, leading to spikes or drops in blood sugar. Kidney function. Diabetic patients are at an increased risk of developing kidney problems. Some painkillers, particularly non-steroidal anti-inflammatory drugs, NSAIDs, can potentially cause kidney damage or worsen existing kidney issues. Blood pressure. Hypertension is another common complication of diabetes. Certain painkillers, especially NSAIDs, can elevate blood pressure or interfere with the effectiveness of blood pressure medications. Care should be taken when prescribing NSAIDs to diabetic patients with pre-existing hypertension. Gastrointestinal concerns. Diabetes can also affect the gastrointestinal system, leading to issues like gastroparesis, delayed stomach emptying, or other digestive problems. NSAIDs can cause gastrointestinal side effects, such as stomach ulcers or bleeding. Safest painkillers for diabetic patients. Here is a list of options along with the reasons for their safety. Acetaminophen, paracetamol. It is generally considered safe for diabetic patients because it does not significantly affect blood glucose levels. It is effective for relieving pain and reducing fever. However, it does not possess significant anti-inflammatory properties. Tramadol. Tramadol is an opioid painkiller that can be considered relatively safe for diabetic patients when used under medical supervision. It is a weaker opioid compared to others and may have a lower risk of respiratory depression and addiction. However, it should still be used with caution and monitored closely. Topical NSAIDs. Non-steroidal anti-inflammatory drugs in topical forms, such as gels or creams, may be safer options for diabetic patients. When applied to the skin, the systemic absorption and potential side effects are generally lower compared to oral NSAIDs. Topical NSAIDs can provide localized pain relief without significantly affecting blood glucose control. Lidocaine patches. Lidocaine patches are a topical anesthetic that can be applied directly to the painful area. They provide localized pain relief by numbing the nerves in the skin. Capsaicin cream. Capsaicin is an active component found in chili peppers and is used as a topical analgesic. It works by depleting the neurotransmitter responsible for transmitting pain signals. Capsaicin creams can provide relief for certain types of pain, such as neuropathic pain. They do not interfere with blood glucose levels and can be a suitable option for diabetic patients with localized pain. Duloxetine. Duloxetine is an antidepressant that also has analgesic properties and is sometimes used to manage diabetic neuropathy. It works by increasing the levels of certain neurotransmitters in the brain and spinal cord that regulate pain. Duloxetine can be an option for diabetic patients experiencing neuropathic pain. Gabapentin and pregabalin. These are anticonvulsant medications that are commonly used to treat neuropathic pain, including diabetic neuropathy. They work by stabilizing overactive nerve cells, reducing pain signals. Gabapentin and pregabalin are often considered safe options for diabetic patients, but they should be used under medical supervision, as they may cause drowsiness and other side effects. Aspirin. It is an over-the-counter pain reliever and anti-inflammatory drug. While aspirin can affect blood glucose levels slightly, it is generally considered safe for most diabetic patients when used in low doses for short periods. However, individuals with bleeding disorders or other medical conditions should consult their healthcare provider before using aspirin. It is essential to remember that even though these painkillers are considered safer options for diabetic patients, individual responses to medications can vary. Diabetic patients should always consult with their healthcare provider before starting any painkiller, especially if they have other medical conditions or take additional medications. Thanks, and don't forget to subscribe.